600,000 people in the state of Michigan with disabilities that are elderly or low-income mothers have been denied access to preventative and corrective dental care.
Preventative and restorative care was cut in October of 2003, which is almost 2 years ago. And since then, people must go to emergency rooms because only emergency care is currently covered under Medicaid where teeth are extracted.
Just a few weeks ago, Henry was hitting his face, chewing on his clothes, and we were trying to find help for him. Henry spent 2 weeks in pain going to several doctors and emergency rooms with no results. And when they looked in his mouth, they saw the horrendous condition of his gums and teeth. None of his teeth could be saved. They pulled all of Henry's teeth. It is over $22,000 for treatment at U of M, and the total cost of about $25,000 for all the doctor visits, ER visits that were made in seeking care. If Henry had received the Medicaid dental coverage for regular preventative care under general anesthesia, it would have cost about $2,000.
Some of the patients are coming into our clinic already swollen to the point that they cannot breathe. They are sent to the emergency room and they end up intubated and hospitalizations, minimum of a week, up to 2 to 3 weeks required possibly for IV antibiotics.
Have you ever seen an old person in pain, a kid in pain, a person that's physically or mentally challenged, in pain? How can you possibly deny coverage for that? This is the United States of America. Oral health care is primary care. That's my message on behalf of the Michigan Dental Association and our 5,500 member dentists.
I did not like what Medicaid's done, so what I done is fighting for people who need Medicaid, because I don't think it's fair to anybody. They need to go to the doctors, to the dentist, all that stuff.
I need dental care because I have lost 3 teeth in the last year and a half. And it's very, very important that I get my teeth fixed. Please pass this bill.
And the results are continuing to come in after 2 years of the Medicaid cuts. This crisis is just in its beginning stages. We know, okay, you're asking me what's the future going to hold maybe. The future, I can tell you right now that more people will be dying of heart attacks just because they had untreated gum disease. More people will be dying of strokes just because they had untreated gum disease. More people will be dying of diabetic complications, kidney failure, just because they had untreated gum disease.
And it's critically important in terms of making sure our everyday health, and also when we look in terms of, you see more and more studies in terms of long-term the health impacts of having appropriate dental care. And so honored to work with so many of you around the state, and we'll continue the battle.
So I think it's important that we, as legislators and policymakers, understand the importance of regular checkups, that we do go have our dental concerns addressed on a regular basis.
Adults should be provided with dental care if they absolutely cannot afford it, because it leads to much more complicated, more expensive problems. I have an employee who did not get proper dental care and almost died from the infections and problems that resulted from what most of us consider to be a tooth decay. So it is very short-sighted to think that we're going to save money by denying adults dental care when they absolutely can't afford it on their own.